Hi, I'm Gavin Giovannoni. I'm a neurologist based at the Royal London Hospital in the East End of London, and I'm chairing the second series of the Moving Science podcast. And in series 2, we are focusing on brain health, and this particular podcast is on Get Moving, how physical exercise boosts brain health for everyone, including those with neurological conditions. And I'm joined today by Angeli Mayadev, who is a physical and rehabilitation expert. So, Angeli, would you like to introduce yourself to the audience?
Yes, it's a pleasure to be here. Thank you so much for having me on the podcast today. As Dr. Giovanni had mentioned, my name is Angeli Mayadev. I'm a physical medicine and rehabilitation specialist, and I specialize in the rehabilitation of patients with multiple sclerosis. I'm based in Seattle, Washington at the Swedish Neuroscience Institute MS Center. I've been practicing there for approximately 17 years. And we have a multidisciplinary team there, and we do focus on wellness and rehabilitation. We have physical therapy, occupational therapy, and various wellness programs.
The important message is that exercise is good for brain health. And most people accept that. What I'd like to say is somebody does not exercise, can you say they're unhealthy or they have a brain unhealthy lifestyle? And how would you what's your take on that?
Yeah, I think that's definitely a way to put it. I think another way to say it is that they're not doing any benefit to their brain health. We know that exercise does a multitude of things for brain health. Number one, it increases mood through endorphins and various neurochemicals. We know that it promotes growth of certain areas of the brain, such as the front part of the brain, the frontal cortex, and then also some of the deep parts of the brain, the hippocampus, that are important for memory and learning. We also know that exercise helps increase oxygenation and blood flow, which also boosts thinking and memory and cognitive skills. And we also know that there's some neurochemicals, one in particular called brain-derived neurotrophic factors that actually may help stimulate brain growth. So in multiple sclerosis, we use exercise almost as a way to help modify the disease in a positive way through all these means. And exercise is a really important means to do that.
So you would classify exercise as a disease-modifying therapy, would you say?
I do. And I talk with my colleagues, the MS neurologists at the center all the time about this, that we consider exercise as disease modifying, in addition to the disease modifying therapies that we all know have really come about quite well in MS over the past 20 years.
Now, you've described some kind of biological mechanisms in terms of the neurotrophic factors and the metabolic health, improvement in the function of the brain. And so the sedentary person would say, well, surely this is druggable. Is there anything I can do? Take a pill, or can I change my diet to mimic exercise? Is there anything people can do that can mimic exercise without exercising?
Well, we do think that exercise and diet go together, in that we know that exercise also helps reduce all of those comorbidities that we talk about in medicine, like reducing high cholesterol, reducing blood sugar, reducing being overweight, reducing almost like it makes you actually a healthy eater when you exercise. And we know that having a high salt intake in MS is correlated with a poorer outcome. So in those regards, I tell people there's no pill right now that can mimic all the things that exercise does. But exercise along with diet can be a good, healthy diet, can be helpful to reduce all the other medical comorbidities that we know can worsen MS.
So there's no shortcuts, in other words, yeah.
There's no shortcut. But what I do tell MS patients is, even for the non-neurologic patients, the American Academy of Sports Medicine, all of the academies of science recommend a certain amount of exercise per week for all of us, and that's aerobic exercise, balance exercise, strength training. So no human being on this planet gets out of being mobile and having to exercise and be active.
Now, you mentioned moderate aerobic exercise, but there's this big debate going on in the MS field about which is the best form of exercise to generate the maximum benefit. And there's a group of people that are pushing for HIIT, high intensity interval training. What is your take on which is the best form of exercise for people with multiple sclerosis?
Yeah. So I think it depends on their level of ability, because we tailor that exercise prescription based upon what someone's able to do. And so we'll take our patients that are very active. And then I think high intensity interval training for them is a great way to go. You can shorten the amount of exercise time that you need in order to get the same benefits because your heart rate stays up, sustained during the periods in which you're not working as hard. And a really example of high intensity interval training is walking quickly for 4 or 5 minutes and then walking at your regular pace for maybe 8 minutes. Or you can do any version of that. It can even be 2 and 2. But basically what you're trying to do is increase your heart rate for a certain amount of time and then go at your regular pace. That can be done through cycling, swimming, walking, running. And as some of our patients that are more disabled, we still can do HIT through recumbent bicycle, weights. So there's different ways to do it. The other way to get good brain health exercise is doing some mind-body exercise techniques. And these have become very popular lately. Things like chair yoga, regular yoga, Pilates, Tai Chi. These things are focused on breathing, deep breathing, and also calming the mind, which we know helps brain health in addition to movement. So I recommend both of those for brain health.
So I picked up from you that there is no limitation, even for people that are quite disabled further along in the terms of the disease course, wheelchair users, for example, not to exercise. So exercise is a recommendation for everybody, doesn't matter where they are in the course of their disease. Is that correct?
That is correct. And we actually have an adaptive exercise program where we have a gym with adaptive equipment. And so in that gym, we have things like weights that people in a wheelchair can pull up to. We also have some motorized arm bikes and leg bikes. So patients that have some ability to move their arms and legs can still do so, but then the motor kicks in so they get some range of motion and help for their cardiovascular system. It's also good for spasticity, which is kind of involuntary movements, like muscle movements in arm that patients get with MS. It also helps reduce swelling. So there are adaptive pieces of equipment that people can use. A really good example of one is an arm bike. And I tell patients that if they're primary wheelchair users, but they still have some movement in their arms, they can even potentially tie the arm to the bike and still get some version of the high intensity interval training we were talking about.
Now, one of the things that a lot of people with MS complain about is heat sensitivity, and they find that exercise raises their body temperature. Is this a big issue, do you think, or what do you recommend people do who have heat sensitivity?
Yes. So this was a phenomenon described. It's called the Utah phenomenon. And what happens when MS patients get overheated is they actually start to reduce the nerve conduction. And so those symptoms that they have are very real. And that typically started off with having blurry vision when people got overheated. And then it could also be numbness in a limb or weakness. Now, it is transient, and there have been no studies to show that there's damage from that. But that being said, it's unpleasant and we try to avoid it. So some things that we do in our center is we use cooling fans. We also have patients cool their great vessels before and during exercise, the great vessels being all the vessels of the neck, the vessels around the wrists, and sometimes the vessels near the armpits. You can use cool packs or a cooling towel, and it can really cool the body. And I think that's another point to bring up is swimming. If you swim in a cooler pool, that being something between 80 and 84 degrees Fahrenheit, it actually can be cooling during the entire workout. And that's a good way to exercise in a pool where you have the buoyancy forces to kind of support you. You don't have to worry about balance. And then also you don't have to worry about overheating. So those are ways to kind of combat the heat sensitivity. There's also cooling vests that you can get where actually they're there are built-in cooling packs, and we recommend patients wear those for exercise.
So we have them available in the UK as well. Unfortunately, our healthcare system doesn't cover the cost of the cooling packs and the vests. And that's another thing that's one of the hurdles for access is, do medical insurance, particularly in the United States, cover exercise prescriptions? Will they, for example, cover gym membership or the personal trainer to help with exercise or not?
So most insurances do not, especially the government insurances, Medicare and Medicaid, but some private insurances will have like a rewards program for healthy living, in which case they will have a gym membership. And that being said, Medicare and patients over 65, there is something called the Silver Sneakers program where they do have some specials work out with gyms. So I would recommend the patients in the United States that are eligible for Medicare to look into the Silver Sneakers program. The other thing that we tell patients is you can utilize your physical therapy and occupational therapy benefits to kind of get a good exercise program going, and then hopefully utilize some online tools. A lot of MS societies, and in the United States, National MS Society and the MS Association of America, and I'm sure in Europe and Canada as well, they have a lot of online videos for patients with MS for exercise as a means to keep up compliance.
So that's actually an important point. This doesn't have to be done face-to-face, so it can be done online, which is something people don't appreciate.
Yes. There's been good studies in the rehabilitation medicine literature that tele-rehabilitation is almost as effective as rehabilitation in person. So we recommend even if someone's not able to get to a physical therapist or occupational therapist, if they're able to get access to something online, it can be quite effective. And then that also brings up our point about exercise compliance, how it can actually be helpful to have motivating factors to exercise. And the online community, like social media, online apps, they have a lot of good videos for patients to utilize to exercise using that as a tool.
Yeah, so I mean, that's an important thing to stress. So the access to exercise, particularly if people are potentially socially isolated, is much easier than it was in the past. And I think people should appreciate that there's a lot of these online and different platforms now for them to use. That's another aspect of exercise that I think is underappreciated, particularly if there's group exercise, is the social interaction that group exercise classes can do. And I think, from my own personal experience, we have a ability to do social prescribing in the National Health Service in the UK. And if people then take up the social prescribing and go off to an exercise class, they often meet friends and new friends and interact with other people. And I think that's also a hidden benefit of interacting with an exercise program. How do you motivate people with MS to adhere to exercise programs? Is there some magic way because it was one of the problems we have? We recommend it at almost every consultation, and the number of people that actually stick to it is actually quite low. Yeah, and that's one of the problems. One of the problems I have is keeping people motivated and engaged.
Yeah, I think one of the studied tools to increase exercise compliance is what you had mentioned, what Earl had mentioned, is exercising in a group. And that can either be physically with other people, so you have an exercise buddy, or it could be an online group, like a class that you take online, or even one that's recorded. But this idea of picking a time of day, I always tell patients they'll increase their compliance with exercise and exercise regimen long-term if they pick a time of day that sticks with them. And a great analogy is how we in the United States have been ingrained to brush our teeth twice a day. It's just something that you do all the time. And so it's the same thing. You got to have a brushing your teeth time that's equivalent for exercise. And the other tool that I think really helps increase exercise regimen and compliance is getting a formal program with a therapist or a personal trainer, someone that you can work with, that you get a designed program for you. And of course, that's going to change over time. It's going to be modified based upon symptoms that you have, that patients have at the time. But I think that basis is quite helpful.
Now, I suppose there's the other extreme. We have some people that just potentially overdo their exercise. I mean, can you overdo exercise?
As from a health standpoint, the risks of overdoing exercise if a patient has multiple sclerosis is that you could get this Utah phenomenon like we described, like weakness or tingling or numbness, or sometimes could potentially lead to falls if you're having weakness and fatigue. So what we tell patients is start a little bit lower than you would anticipate doing in time, and then work your way up gradually. And so it's not that a patient's going to do harm to themselves by overexercising, but they can put themselves at risk for falls. So we tell them pacing is key. Pace themselves with their exercise to ensure that they are safe with it.
And I suppose there's the issue of fatigue. Some people find that they just get so tired from even doing minimal exercise. One of the problems that we have from the chronic fatigue field is that exercise actually makes the fatigue worse. And I try and tell people with MS, this is not like chronic fatigue syndrome. This is a different type of fatigue.
Yes, I agree. I think, we were talking earlier about the neurochemicals and the endorphins that exercise produces. And so, even if patients have fatigue during the exercise, we tell them, keep going to the point where you're able. And you could start, like we were saying, start slow and small amounts. And then afterward, because of those endorphins and those neurotrophic factors and the neurochemical factors, it does lead actually to more energy and to more kind of cognitive clearing. And patients will describe like how they feel very clear after they exercise mentally. And I think it also has to do with increasing blood flow to the brain too. And you're getting more oxygenation to the brain.
So one of the benefits is not so much just on the physical side, but it also seems to help people with mental health. It helps with low mood, helps with sleep. We know that it improves bone and also counteracts sarcopenia, loss of muscle bulk. And do you want to make a comment about if somebody is resistant? Now, this is really important. Sometimes when you recommend exercise to somebody, they're resistant. Is there anything we could do from a healthcare professional perspective to try and change that attitude or that behavior, a resistance to exercise? Because some people just don't like exercising.
Yeah. In my first visit with patients, I do ask them what their exercise history is like and what they like to do. I think when it comes to movement, even a simple thing like, is there any movement activity that you enjoy? And that could be maybe going to a baseball game or doing things that wouldn't typically be exercise. But if you think about all the things that involve going to a baseball game and being there, there's definitely steps involved. There's getting in and out of the stands and out of the chair. So we really focus on mobility and movement if patients are more resistant to the formal exercise. The other thing that we have in our program is we actually have a program through our foundation that we help fund because as we all had mentioned, traditional insurance doesn't cover these things. But we have an adaptive adventure program. It can be also termed an adaptive sports program, where we have adaptive trips like sit skiing, adaptive snowshoeing, adaptive kayaking. And so we partner with various nonprofits to help patients get out in nature and out into the outdoors. We have a adaptive cycling day. And so what I also recommend patients to do is, just on the internet to look up any adaptive sports program or adaptive exercise programs in their area. It may not necessarily just be targeted to MS, but that can be helpful to increase compliance, just to get people out in nature, which there has been recent evidence to show that for all of us, that can increase healthy living and longevity. The other thing too is for some of our patients that enjoy music, we actually have a music therapy program where we're trying to couple mobility and movement to beats and dance. And so that's another way to get moving, even doing chair dancing or even things like chair yoga or some of the mind-body techniques as another way to help increase exercise in patients who might be resistant to a gym or formal exercise program.
So coming back to the real base take-home message for somebody watching this who has multiple sclerosis, how many times, what is the minimum number of, what is your minimum exercise requirement? Once a week, 3 times a week, 5 times a week? Would you recommend? Or should it be daily?
Yeah. So, we do follow some of the Canadian MS Society guidelines. They recommend aerobic exercise at least 3 times a week. And they also recommend strength training at least twice a week. There's good evidence in just layman literature that we're targeting around 150 minutes of aerobic exercise a week, coupled with at least 30 minutes of strength training twice a week, plus balance exercises. So in the MS population, we can modify that a bit, but that is still a goal. So I do tell patients at least 3 times a week of aerobic, at least twice a week of resistance, and then some balance exercises at least 3 times a week.
Okay, we're coming close to the end of the podcast. Angeli, would you like to sum up a message for the community?
Yeah. We always say in exercise science and in rehabilitation medicine that it is your empowerment, that the power of rehabilitation is yours. In a stage in a disease process where sometimes it feels like you don't have control over things, exercise in whatever way, in whatever quantity, any movement can be quite empowering for an individual.
Yeah, and I'd like to conclude from a healthcare professional is that we probably should walk the talk. It's impossible to recommend exercise to people with diseases that you look after if you're not doing it yourself. And I think, the evidence outside of MS, just in terms of general metabolic, cardiovascular, bone, muscle, brain health, it's overwhelming. And it's probably the only anti-aging therapy we have with convincing data. People exercise, live longer and have less chronic disease than people who don't exercise. So I think we have to walk the talk as healthcare professionals. It's very difficult to dictate to your patients if you're not doing it yourself. That's what I would say. Okay, so I'd like to thank you for participating, Angeli, and hopefully we get some feedback, and maybe we'll get an opportunity to answer some questions in future podcasts. So thank you very much.